Hello everyone. Um, well, 2020 has taught us one thing, the virus. And the best way to avoid the virus infection has been hand hygiene. Hand hygiene has always been essential to us as surgeons. This is our wash up area, and we don't want to pass on the infection to the patient. So, we have been taking precautions day in and day out for the last 25 years. But it is now time that these precautions are taken by everyone. So, hand hygiene is tremendously important. Um, this is a place where everyone makes a mistake. The infection is then carried from one person to other person, and worse still, the infection is carried from that person to your own self. If you wash your hands, it will completely eliminate all viruses and all bacteria in this world. So make sure that you wash your hands in the exact steps that I want to show you. This will prevent infection transmission, infection to your own self, and it will maintain complete sepsis. So let's learn how to do it. Come over here. The first place is where you should wash your hands. Wherever you wash, it should be an adequate space, because after washing you should not touch the walls. That is a bad thing to happen, because that's unsterile, obviously. So first place, decide where you are going to wash up. Not all places will have handles like these, so you can have a running water. You're not washing up for surgery. This is for surgery, but if you're not washing up for surgery, you're just washing up for hand hygiene, then you can have the tap turned by your hands. So space is important. After the hands are clean, they should not touch the basin. That is important. Next point is, once you start washing up your hands, I'll show you practically now. First, wet your hands. What will this do? If there's any dirt which can be washed away with water, water, believe me, is the best detergent to start with. Its pH, its acidity, everything kills bacteria right to start with. So first of all, wet your hands. Any dirt which is stuck to the hands will get washed off. Second is the selection of the soap. Now here we have betadine. This is betadine. But make sure that the soap has good lather. Why? Two reasons. Because all viruses, they live in a fat environment, and soaps always emulsify fats. So all soaps, number one, will emulsify all the fats. The lather will give you an idea where the hands have been applied with soap and where they haven't been. Right now you can see I have applied soap to the palms, but there's nothing on the back. Okay. Now when I apply betadine, it's like the haldi applied in Hindu weddings. You can see which area has been applied and which hasn't been. Okay. So make sure that you have good lather all over. So take adequate amount of soap. Once that has been done, once you have taken the soap, start rubbing your hands. Okay. The palms are the most important part to start with, but complete hand is very important. So step one, rub your palms. Okay, rub your palms together. Step two, interlocking fingers. Okay, because the web spaces are where infection resides. So rub them like this and rub them from the back as well. So interlocking fingers is step number two. Okay, then circular movements on the palm will get rid of some infection in your nails. Mind you, having good long nails is only good in non-corona times. In corona times, long nails are bad. So as far as possible, ladies, please don't keep long nails. Okay. So make circular movements on the palm, that will take care of the nails. So step 1, palms. Step 2, interlocking. Step 3, nails. Then coming to step 4, interlocking of the fingers. This will take care of the back of the fingers near the nails. It will take care of the front of the fingers, 4 fingers as we can call them. So this is step 4. Okay. Once this has been done, go to the back, rub the back. The back should be done a little later, which is fine, because palms are the most important. Now I have lather on my palm. The lather has enough time to kill all the bacteria and viruses on the palm. So now I'm cleaning the back of the hands. So this has been done. Now you can see lather adequately onto my hands. And then the final step, cleaning of the wrists. So here we are cleaning the wrists. Okay. So once this has been done, you can then clean the thumb. Okay. So cleaning of the thumb is also equally important. Web spaces and the web space between thumb and the forefinger and the thumb itself. So cleaning of the thumb. So these are the 7 steps. Washing of palms, then interlocking web spaces, then circular motion, number 3, number 4 the wrist, then back 5, wrist 6, and 7th will be the thumb. Once this has been done, again now here I have the pleasure of opening the tap with the elbow, but you might have to open it or ask someone else. That is the best way to open. Now let there be adequate water running on your hand, because this lather has now killed all the bacteria and it has to be washed out completely. While washing also, make sure that you have adequate water running and rub all the areas in the same sequence. Quicken the palms, the fingers, interlocking fingers, this, and from sterile to unsterile. Preferably don't touch unsterile. Let the water go from sterile to unsterile. From sterile to unsterile. Let the water go from sterile to unsterile. Sterile to unsterile area. Okay? And once this has been done, once you have washed up, keep your hands up. Last step, keep your hands up. Pray to God. Okay? Keep your hands up so that all the water goes down your elbows and it does not come back in. Once this has been done, it's best to have a clean towel or even better disposable tissues which are on a higher level. Once you have them, pick up the tissues and wipe your hands. Okay, that would be the ideal most way to clean your hands. Hope you have a healthy and a fit life ahead.